everybody, my name is Elisa. I'm back and we are going through the lymphatic system, and now we're going to look at some of the regional features of the lymphatic system. So we're going to start with the thoracic region. So the thoracic region is like the thorax of the body. So one of the most important things I kind of want you to look at right here is this like tiny little bit. So this is, moved. There it is. Okay. So this is that all important part of where the lymphatic system actually is going to act and actually dump off lymph into the venous system, right? Especially going into vena cava, right? So I wanted you to see that component. So this is the right lymphatic duct, and it's going to the right subclavian vein. When we talk about the nodes of the thorax, there's a couple of things that are really important. So the thorax has right here, axillary area has like a lot. There's a lot of excretion at this point in the body, and so those can be easily monitored, but also in the mammary regions right here. So there's a lot of lymph nodes here. So we'll be checking these for, say, like breast cancers, infections, um, clogged ducts, right, for women who are lactating and otherwise. Within the thorax proper, so here we are. So internally we have some more of these like duct systems, right? So they are jumping right into the veins. So subclavian vein and subclavian trunk themselves, and so they're going to go eventually drain it through vena cava back into the rest of the body. So you'll notice that they also follow the veins themselves. So the right and left jugular trunks are right next to the jugular veins, the internal jugular veins themselves. Let's see here. Bronchio-mediastinal trunk is coming in here um, after going more proximal to where the top part of the apex of the lung is. Thoracic ducts themselves is like this larger, longer strip right here in the center, medial of the body. Let's see here, where else is kind of used? Oh, yes, this one, cisterna chyli is down here, right? So this is going to be kind of like a big collection duct, a cistern, if you will. Let's see here. Intestinal and the lumbar trunks are also going to, here's the right lumbar trunk, are also going to meet up here at cistern chyli. So there's kind of like a lot of lymph that's collected and dumped into there as well. Okay. Oh, wait here. There it is. Okay. Oh my gosh, sorry, my picture. There it is. Okay, so the flow of lymph. So the lymphatic system, the lymph itself is going to flow under forces similar to that govern the vein return, except there's no pump, but there also kind of is. So in this case, what we're looking at is the pump is the heart, but not directly, right? So it's really just like the pressure, the arterial pressure going into the interstitial fluid is going to push, mostly everything back into the veins. And sorry, oh my gosh, that's terrible. Give me a second. Mostly into the veins, and then slowly a little bit more is going to dump into lymphatic. Okay, so lymph is going to be flowing at a lower pressure. So we use a lot of valves also in the lymphatic vessels. So it's moved along also by some of the contractions, tunica media of the lymphatic vessels, and so that's like a smooth muscle type tissue. Let's see here. Also, flow is aided by the skeletal muscle pump, which is also somewhat similar to the veins themselves, the circulatory system. So the skeletal muscle, as it moves, as it pushes, as it becomes swollen, is going to actually physically change the lymphatic vessels, kind of squeezing everything over. So, like again, cardio is important. Anything that's going to like cause those skeletal muscles to swell and to to actually possibly like move around is going to help that as well. Arterial pulsation, we talked about that a little bit, can also squeeze the lymphatic vessels to some extent. The thoracic pump is also going to aid in flow from the abdominal region because you don't have a whole lot of those skeletal muscles as well up to the thoracic region as well. The valves, which we've been talking about quite a lot, are going to prevent backward flow, and they work just like the locks of, like, the Panama Canal, and they just continue stabilize pressure as fluid is just slowly and regularly moved up and into the vessels themselves. Also, there's going to be some adhesion cohesion type action also, because the rapidly flowing blood in the subclavian veins is actually going to, hold on to the water in the lymphatic system. So the water in the blood is going in the blood plasma is going to grab onto that water in the lymph, and it's going to actually pull it closer together, right? And so that's going to, like, kind of have a capillary type action there. And we talked a little bit about exercise, particularly cardio, increasing lymphatic return, but also some, maybe possibly weights or strengths, anything that's going to really cause those skeletal muscles to swell up and get large. Okay, so that's pretty much it. Next, we will talk about some of the cells of the lymphatic system. I hope that was super helpful, and I hope you're having a wonderful day.